serial killer is the subject of an episode in a new docu-series out today. In 2021, former nurse William Davis was sentenced to death for killing at least 4 patients at the Christus Heart Hospital in Tyler.
People usually think serial killers are far away, like in movies. But sadly, they can be closer than you realize, even at places like a store, a bar, or even a hospital. And no, the hospital part isn't just a made-up scenario. There's a guy named William George Davis, a nurse who turned into a killer. He took lives, not just 1 or 2, but many.
Turns out a hospital is the perfect place for a serial killer to hide.
In a place where people visit seeking to make their lives better, a hospital. This isn't your usual case. It's way more sinister than you can imagine. So, let's take a look at everything that happened. Many serial killers have a common background in their childhoods. Isolation, bad relationships, signs of being a bit psychopathic, or even abuse. But it's tricky, because not everyone with these experiences turns out the same. But it turned out to be somewhat true on the part of Davis. He was born in Hallsville, Texas, on February 3rd, 1984, in a loving family with a regular income. People around him described him as someone who had good social interactions, and his co-workers and classmates spoke highly of him as a kind and caring person. The fact that he was a nurse was more than enough proof that he had been doing well in his studies in high school, and that continued until he started studying as a nurse. However, according to his own accounts in an interview with former FBI Special Agent Brianna Fox, he told her how he wasn't doing that well mentally when he was an 18-year-old in 2002.
Hi, Will.
Hi, Dr. Fox.
Hello, you can call me Brianna.
Brianna?
Yes, thank you for having me. One thing I really wanted to talk to you about was, your childhood. I think that was maybe one of the first times that you started feeling a lot of anxiety and depression.
Depression. I had a lot of depression in the fall of 2002. Went to Kilgore College. I felt like there was no hope in life. I didn't know what I wanted to do for a career. I went to the doctor at that time for that, and he had prescribed me, I guess, an SSRI for depression, and then I wasn't on it very long, and after that, and then that's when I tried to run my truck into a tree, committed suicide, and had just a bunch of different acts like that weren't good. They said I was bipolar, put me on Depakote and lithium at that time. To be honest, I don't feel like I never really thought I was bipolar, but I know they had mentioned bipolar. I never went back to get on that medication. I just kind of more or less turned into a anti-anxiety, antidepressive type.
It's much more likely that ignoring his diagnosis and not getting treatment at this point could be one of the causes of the shift in Davis's mindset later on in life. Because when you take a look at the surface level, everything seems fine for him, which is mostly the case for many criminals like him. He worked at Good Shepherd Medical Center, known as Christus Good Shepherd Medical Center Longview, from 2011 to 2013, according to Will Naus, a spokesman for Christus Health Northeast Texas. Even in adulthood, he wasn't alone. He had a wife and 2 kids, the youngest born in December 2017. He continued his nursing career at Christus Trinity Mother Frances Hospital in Tyler, Texas, for around 5 years until he was fired in 2018. By then, he had been a nurse for almost 7 years. But something changed along the way, horribly so, and came to a point where he was involved in accusations of murdering and causing life-threatening injuries to at least 11 victims while working as a nurse. That means he went against the very oath known as the Florence Nightingale Pledge, which many nurses take as they often promise to take good care of patients, be ethical, provide the best care, and follow the rules. And it's safe to say he broke every single one of those promises to his profession and humanity. That raises the question, what had happened? So, let's get started by taking a look at all the victims who suffered fatally from this wretched man. When Fox asked him if there was a case where he was directly involved and failed to mention, he said there was one from 2006. In this case, there was a 96-year-old woman with a do not resuscitate order.
There was the 96-year-old elderly lady in 2016. I did fail to mention her, and that was more of a mercy thing. She was 96, she was a DNR, do not resuscitate. I mean, she was basically end of life. It's hard to sit there and watch her suffering.
The thing is, he was never allowed to take action the way he did unless there was a medical emergency.
Basically, I gave her potassium chloride to stop her heart. I gave her pain medicine so she'd be comfortable. I shouldn't have played God. I should have done that. That was wrong. But it was hard watching her suffer.
Giving potassium chloride is a medical intervention that needs a prescription and a doctor's approval. And as a nurse, he wasn't supposed to give it to the patient, even more so to stop the patient's heart, or even provide pain medicine in a do not resuscitate case without a doctor's orders. And even though he tried to explain his actions as merciful, it wasn't really about mercy. Instead, it seems he had selfish and harmful desires, which later affected more victims and cases. Making a decision like this without facing immediate consequences probably made him think he could get away with doing anything illegal or taking more lives in the future, which he did, as this murder set the base for his killing spree in 2017. But first, let's take a look at Davis's account of when he deliberately attacked a victim. And this wasn't due to his so-called mercy, but rather intentional. According to him, his first victim was James Sanders in 2017.
Sanders, the very first patient, that night, everything started going through my head like about everything. It's like I was upset at the hospital, more the upper people, because I feel like, they're up here sitting in the office, getting bonuses, taking and putting all these orders out for us to do all these things, and they don't even know how hard and what we're really doing, and they're not down here with us. I had to go check a blood sugar. He was on an insulin trip. And when I went in there, it's like I didn't even see the patient, Mr. Sanders. I didn't even see Mr. Sanders. It's like Mr. Sanders is there, but my head is somewhere else. I had a flush in my pocket. I had to check a blood sugar, so you have to use the arterial line for that.
The first thing to understand here is how he committed the murder. As he confessed, he injected air into his victim's arterial lines, which caused an air embolism, which occurs when air bubbles block veins or arteries, resulting in severe damage to the central nervous system and other organs. When air enters arteries to the brain, it can cause immediate loss of consciousness, seizures, or strokes, and if it enters arteries to the heart, it may lead to a heart attack or abnormal heartbeat. So it's no surprise that these conditions are very serious and can be fatal if not treated quickly. Davis, with his medical background, was well aware that healthcare professionals take precautions, such as removing air from syringes before injections. And he did the exact opposite, intentionally using this knowledge to take the life of his victim. And he was also familiar with the fact that by doing this, he could pass it off as an accident, which he did for months. But now, let's listen to what he felt like when he committed this heinous crime.
Doing this, I'm getting this euphoria, there's this exhilarating force going through my body in my head, and I'm just feeling like I'm out of this world. You're thinking, oh my gosh, it's almost like a drug, like you're getting a high off a drug or something. But then that feeling afterwards, whenever people would come rushing in, or you'd have the code button going off and people would rush in, you would get it would amplify that feeling I had. It gave me this control, the power, that euphoria that went through, that exhilarating rush that goes through your body.
Firstly, you have to focus on his language and how he attempted to justify his actions. He claimed that his frustrations towards superiors earning more than him while seemingly doing nothing motivated his actions. However, this justification may not entirely align with the truth. As a murderer, it appears he's trying to find reasons for his deeds to gain some sympathy and rationalize his actions. Additionally, his way of speaking almost sounds like he's reminiscing about the situation. Another significant point is that the clip is from an interview conducted long after the trials, years after the crimes occurred. The fact that he goes into such detailed recollections in so much detail about how he felt shows the act was rather deliberate. Not to mention that even this involvement was disregarded as just a natural complication. That allowed Davis to attack his next victim, which happened to be John Lafferty, whom he attacked in the same way the very next day. This ex-IRS special agent was admitted to the hospital for a checkup when there was a complication in his case. Without any apparent reason whatsoever, Lafferty had a stroke and died shortly after. But we know what happened. However, the fact that Davis had been working in the hospital for 5 years and was generally regarded as someone who was friendly and pleasant to be around was one of the primary reasons that no suspicious activity was suspected once again. And it was believed that there was probably just a natural complication in the case of Mr. Lafferty, who died June 25, 2017 in Tyler. It wouldn't be after several similar cases that hospitals started to notice a pattern. Strokes, like the previous 2 victims, aren't that common. But by the time they could understand that something suspicious was going on, Davis had gotten addicted. In his own words,
Walk in, go in, do the same thing. And even afterwards, having that peace and that calm, it's like I didn't worry about bills. I didn't think about money. I didn't think about the stresses of life. It was like I just kind of relaxed. But then thereafter, it really became more of an addiction.
Apparently, it was horrible, but not horrible enough to stop him, because even after that, he did this several times, and the next death would be after a while, which allowed him to continue his spree without raising any suspicions. 68-year-old Ronald Clark, similar to many other victims, was admitted to undergo cardiovascular surgery. Ronald was checked by the surgery preparation team to make sure he was ready and healthy for the operation. After they confirmed he was good to go, the surgery happened and everything went smoothly. He was recovering smoothly, and there were no complications other than an undetected serial killer whose presence was not yet known by the officials. That's why no one expected anything to go wrong, not even his daughter, who was planning to visit him the next day. But that very night, Davis made his move and followed the same procedure, which caused complications in the victim's nervous system. Staff did their best to stabilize the patient and put him on a breathing tube again, but it was all too late, and he passed away on July 27, 2017 in Tyler, Texas. This 47-year-old pilot from Tyler was another victim in the murder case involving the Tyler nurse. Christopher went to the hospital for a preventative surgery, a routine coronary artery bypass grafting surgery. The medical team was confident of a full recovery. However, after Christopher was left for his recovery in the CVICU, during a break, the nurse entrusted with his care left him in the hands of another. Upon the nurse's return, a code blue rang out, signaling a medical emergency in Christopher's room. And following the same pattern, he passed away just 2 days later, on August 6, 2017. But what made this case worth mentioning is that it was the one that alerted the staff to put CCTV cameras, which led them to ultimately finding footage of him committing the crime. In this footage, we see him going into the patient's room just before an emergency alarm goes off. Now, who's the one who was his victim this time? Joseph, a 58-year-old man, had to go to the hospital urgently in January 2018 for a heart operation. According to the officials, the surgery went okay. But things got weird in the early morning. Right after Davis, the person we're talking about, left Joseph's room, alarms started making noise. Nurses can be seen rushing to help. Kalina's heart rate was alarmingly rapid, and his blood pressure dropped significantly. If you watch closely, Davis had just left the room. After he heard the alarms, he took his time before calmly walking back to the patient's room. That walk. It's not the pace someone would walk on when they're trying to save a life. It's more like someone who might be part of the problem. When other nurses were busy helping the patient, Davis was just standing there, not really doing much. It's weird because he's supposed to be a medical person who helps, but he looks more like he's just watching things happen. He never mentioned to his fellow nurses that he had just entered the room, which makes it even more suspicious. After stabilizing him, Joseph was transferred for an MRI, which revealed massive strokes affecting both sides of his brain. Joseph spent multiple days in the intensive care unit following the stroke, and was eventually discharged to a long-term rehab facility. But sadly, due to the complications, he passed away just 2 years later. The hospital carried out an independent investigation following this incident, Not soon after asking around the other nurses, they realized that Davis, who was actually described as friendly, had a bigger hand in it than it appeared. Davis was accused of entering other patients' rooms in November and January and taking actions that caused 2 patients to fall into vegetative conditions, even though he wasn't assigned to care for them. When questioned, Davis claimed he silenced an IV and performed other actions according to his suspension order. While the investigation was ongoing, Davis even called the hospital to ask about what was going on and whether or not he was the only one being investigated for the case, all the while trying to maintain his innocence. He eventually got fired from his job at Christus Trinity Mother Frances Health System on February 15, 2018. The Texas Board of Nursing suspended his license on March 6 following Section 301.455 of the Texas Occupations Code. This section allows the temporary suspension or restriction of a Texas registered nurse's license if their continued practice poses a significant and immediate threat to public welfare. Unfortunately, many victims had suffered by the time Davis was let go. Some didn't make it, and we've discussed the stories of all of them. Others, like Pamela Henderson, Ricky Glenn, James Wages, and Gary Parker, survived, but had to deal with lifelong complications from the incident. But Davis's actions so far make him seem like a classic narcissist, someone always trying to control things and using tricks to take advantage of people. It becomes clear when he uses another one of his tricks, pretending to be innocent to get sympathy. Around March 23rd, just a bit after the board decided to stop him from nursing, Davis went on GoFundMe with a fake sob story. To make himself appear as a family man who was being robbed wrongfully, he shared a picture with his wife, their little boy, and a newborn baby. According to his version of the story, he had just finished studying to be an acute care nurse practitioner, and that was his big goal. He also tried to make himself seem like a good guy, saying his nursing license got temporarily stopped because of what he calls misunderstandings. This was his way of not taking responsibility for what happened, and the fact that he did this right before he got charged with murder. The GoFundMe was later taken down, but it managed to get $5,495 from 56 people before that happened. He initially maintained this not guilty demeanor even into the investigation. Just a month later, he was facing murder charges for the death of a patient a year ago, and police added more charges for harming other patients in 6 different cases. Despite not having a criminal record, Davis wasn't cooperating with investigators. The investigators from the Tyler Police Department teamed up with hospital authorities and medical experts to collect substantial evidence against William before arresting him in April 2018 and holding him on a $2 million bond.
Stand up for me. Need you to turn around for me. Put your hands right here. Listen up. We're going to put these on you, okay? Got a warrant for your arrest.
He faced charges of capital murder, and 5 counts of aggravated assault with a deadly weapon. The trial took place nearly after 2 years, and on September 28, 2021, at the start of the trial, George Davis entered a not guilty plea.
To this charge, Mr. Davis, how do you plead?
Not guilty.
His defense claimed that he was innocent, all because it was not uncommon for strokes to occur at a hospital, especially in a cardiology department. This continued into the October trial. Here, William's defense counsel contended that he was being wrongfully convicted as a scapegoat in the case. They tried to put the blame for all deaths and injuries of the patients on the hospital's treatment procedures, or negligence to shift the culpability away from William. William even tried to blame Dr. William Turner Jr., the heart surgeon for some of the deceased patients. But the prosecutors countered those statements. They said the hospital didn't have any similar problems after William was fired, even though they kept doing the same medical procedures. In addition to that, the court was presented with evidence of his online searches, which included queries about serial killers and the number of people they had killed. This behavior shows his narcissistic and psychopathic tendencies, and how he has an intense desire for control over the situation. It's likely that he engaged in this comparison to assess his own achievements as a serial killer and measure himself against others who had committed similar acts. On October 19, 2021, at the age of 37, William was found guilty on all 4 charges of capital murder related to the deaths of John Lafferty, Ronald Clark, Christopher Greenway, and Joseph Kalina. The prosecutors advocated for the death penalty, and during the proceedings, they presented a recorded phone conversation between William and his ex-wife from prison.
I don't know. Was there even the slightest bit that what any of the prosecution side was true about you? Anything with any kind of intent?
No malicious, nothing.
Even if you can't admit it to yourself, we're not looking to give yourself an answer, but we need something for your kids.
I'm not gonna lie, I couldn't afford to be off. I couldn't afford to be called off, and I tried to make sure people stayed ICU a little bit longer, just a little bit longer, so that our numbers would work out, so that I could work.
Even in this conversation, he continues to prioritize himself and rationalize his malicious actions by blaming them on financial stressors. Committing the same action precisely over and over again 4 times shows that he wasn't just seeking additional shifts. This also contradicts the evidence he provided, where he claimed to be constantly working and present on every shift. It's evident that his excuses are merely a cover for his true intention of causing harm and damage. Even if financial stress was a factor, it in no way justified taking a life. Such actions not only violated his nursing oath, but also disregarded the sanctity of human lives. He had no right to subject the victims and their families to the suffering he inflicted upon them. Many victims testified in court against him. Gary Parker, originally from Louisiana, traveled to Tyler for his heart surgery. During the testimony, Parker remembers that he recalls signing the papers before the surgery, but everything afterward was blank to him.
So, after the surgery, but it was all it was like I was still under some kind of drugs or something. I mean, I was hallucinating bad.
Dr. Christopher Lowe, who administered anesthesia for Parker's heart bypass surgery in July 2017, testified that there were no notable periods of significant hypertension during the procedure that could lead to a stroke. Once again, Davis was the one responsible for this. Dr. William Yarborough, who is a pulmonologist and professor of internal medicine, explained how injecting air into the arterial system of the brain can lead to brain injury and death. Yarborough said that with decades of experience in medicine, he determined the presence of air in the victim's brains by examining images from brain scans, a phenomenon he had never witnessed before. He also ruled out blood pressure issues and other potential causes, attributing the complications to the injection of air, which he believed occurred post-surgery during the recovery phase. Dr. Kenneth Layton, a radiologist specializing in diagnostic radiology and neuroradiology in Dallas, also testified. He claimed that he could identify the substance in the patient's brains as gas, leaning towards it being air. However, he acknowledged the possibility that another substance could have been injected. Either way, Davis was accountable for the incident. This is why, on October 27, 2021, the jury sentenced William George Davis to death, as they couldn't identify enough reasons to prevent capital punishment. Official court records state that the 39-year-old is currently on death row at the Allen B. Polunsky unit in Polk County, Texas. He seems like another case of a psychopath with an extremely narcissistic personality and no empathy whatsoever. What do you think about this whole case? Let us know in the comments below. Thanks for watching our video. We'll be back with more content like this. So if you enjoyed it, please consider subscribing to our channel and hitting the bell icon to stay updated on our latest content. See you in the next one.